Kawhi Leonard of the Los Angeles Clippers went down with a very bad-looking right knee injury recently, and this was a really concerning one because as soon as it happened, he was in an obvious amount of pain, and he would ultimately leave the game. Now, on the actual play that Leonard got injured on, he was dribbling down the court in a fast break, and he went to cut, but he planted a little awkwardly on that right lower extremity, and when he did this, he started to be in obvious pain, and we saw that he was really wincing in the face, and he did try to play the remainder of the game, however, he ultimately came out. Now, initial reports on the injury were mixed because we did not know a lot of details regarding the severity. However, today, the Los Angeles Clippers released some unfortunate news saying that as of right now, they are expecting that Leonard does have an ACL injury, and currently he's out indefinitely. As of right now, we do not know the exact severity of Leonard's knee injury, but there is a grading system for these ACL injuries, and since some people may not be too familiar with that, I'm going to go ahead and focus on that in today's video. Welcome, basketball fans. For those of you that aren't familiar with me, my name is Nick Gallo, and I'm a doctor of physical therapy. With this video, I want to go over Kawhi Leonard's most recent knee injury against the Utah Jazz in Game 4 of the playoffs. First, I'll start by showing the actual play that Leonard was injured on so that we get a good visualization for his mechanism of injury. Then I'll go over the anatomy of the ACL and what exactly is going on with an ACL injury. Then I'll go over the grading system and what to expect moving forward depending on the severity of the ACL injury. If you like today's video and you find it informative, please hit that thumbs up and subscribe to the channel because I will be making more videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the section below. Now to begin, let's go ahead and take a look at the play that Leonard was injured on. Here we see Leonard is dribbling down the floor and he plants awkwardly right here, and we see that he winces his pain and starts to favor that right leg. Here's another camera angle showing it again right here as he plants awkwardly. So here I have a model of the knee, and in order to form the knee joint, you're going to have the femur bone, which is the bone that is in our thigh. That's going to come down here, and then the bottom part of the knee joint is actually going to be comprised of the tibia, which is the bone that we often associated as the shin, and right here we also have that fibula bone as well. Now there are four major ligaments that contribute to overall stability in the knee when they are intact, and they are, of course, the anterior cruciate ligament, or the ACL for short, and that's located right here. Then as we flip the model towards the medial or inside portion of the knee, this is the medial collateral ligament, or the MCL for short. As we go towards the lateral or outside portion of the knee, this is the lateral collateral ligament, or the LCL for short. And finally, on the back, this is the posterior cruciate ligament, or the PCL for short. And there's actually two other really important structures that are located within the knee, and they are, of course, the medial and lateral meniscus. You can think of these as pieces of fibrocartilage that are going to act as shock absorbers between the two bones. Now, the applicable anatomy of the knee that's associated with this injury, of course, is that ACL. Now, one major function of the ACL is to prevent anterior translation or frontward movement of that tibia. And this is because this is how the ACL is actually attached between the femur and tibia bones. But its predominant function is to prevent this anterior movement of that tibia. Now, we've seen in sports such as football or other contact sports where a player gets hit from behind, and this is going to drive that tibia forward, and this leads to that ACL tear. So this is one of the major functions of that ACL. One other really important function that the ACL does is that it's going to help provide a rotational stability to the knee joint. Now, this is really important when a person is going to be planting and cutting and doing a lot of that, because as a person is doing this, the knee joint is going to want to rotate, but that ACL is going to kick in along with some of the other ligaments to help provide that rotational stability. Now, on the play that we saw Kawhi Leonard get injured on, as he's driving, he plants a little awkwardly, and as he does this, we see that the knee dives in briefly for a second, and then that's when he lifts up his foot because he's in obvious pain in the knee. Now, when a person's knee dives inward like that and they're moving, this is something known as a dynamic knee valgus. When a person goes into this dynamic knee valgus, this is when they're putting a lot of strain on that ACL, and you can kind of see that on this model here. As a person plants and they do that twisting, if the ACL is being stressed, then it's at risk for injury. And if a person does it hard enough with enough force, then it can cause an injury to that anterior cruciate ligament. Now, just because a person has an ACL injury does not necessarily mean that it is a full ACL tear, because there is a grading system for these ACL injuries, and that is grades 1, 2, and 3. In a grade 1 ACL injury, a person is going to get stretching of the ligament, but there's not going to be any tearing. In a grade 2 ACL injury, a person is going to get stretching and partial tearing of the ACL. And finally, in a grade 3, this is the worst case scenario. This is when a person is going to get a full rupture of that ACL. Now, for visual representation of the grades of ACL injuries, we'll use this napkin here. So when a person gets that grade 1 ACL injury, they're going to get stretching, as you can see right here, but there won't be any tearing. In a grade 2, you can think of some stretching, but also some partial tearing, just like that. And finally, in that grade 3 ACL injury, that's when you're going to get a complete tear or rupture. Now, depending on the grade of the ACL injury, of course, this can have a great impact on a person's return to sport time frame. Typically, if a person does have a grade 1 ACL injury, then we're looking at a recovery time of a few weeks. Then, as we go into a grade 2 injury, because it has some partial tearing of the ACL, this can take upwards of about 6 weeks for a person to recover. And finally, in a grade 3, because this is the worst case scenario, and this is when that rupture is going to be throughout the entire ligament, this is when a person's timeline to return to sport is upwards of about 12 months. Now, in order to determine the severity of the ACL injury, it's going to be really important that that person has that MRI. So I expect that any day now we will hear the results of Kawhi Leonard's MRI to determine the severity of the ACL injury. And when we happen to hear the results of that, I'll be sure to update everybody in the comment section. For Kawhi Leonard and the Los Angeles Clippers' sake, I really hope it's not that nightmare scenario of a grade 3 ACL injury, because if this does happen, he is definitely going to miss the remainder of the playoffs. If it's a grade 2, it sounds like this is going to prolong his recovery greatly as well, because it can take anywhere between upwards of about 6 weeks. Now, if it is a grade 1, since this can take a few weeks for a person to recover, this would obviously be the best case scenario here. And if it is a grade 1, because he's going to be getting the best treatment, and I'm sure he'll be very diligent with his recovery process, then I do think it's a good chance that we will see him return throughout the course of the playoffs. But once again, it's going to be really important that we just find out the severity of the ACL injury in order to make an accurate time frame moving forward. And that's it as of right now regarding Kawhi Leonard's most recent knee injury against the Utah Jazz in Game 4. Once again, thank you very much for watching today's video. I really appreciate it. If you enjoyed today's content, please subscribe to the channel, because I will be making more videos in the future. Thanks for tuning in, and I'll see you next time.